gone to sleep to bed and woken up somewhere else? Well, if you did, you possibly did some sleepwalking in the night. Sleepwalking is a disorder that occurs when people are sleeping and they usually do some kind of activity. You can go around walking around your house, or you can move your furniture around, or in my case, you can walk out the door. Sleepwalking is very common in children, and most of you probably did some sleepwalking, but you probably don't remember it. Today I'm going to talk about the causes, the symptoms, and also the treatment for sleepwalking. Starting with the causes. When you are about to start sleepwalking, you have very rapid eye movement going on, but you don't realize it, and you do some irregular breathing, which causes you to wake up. So you usually start sleeping down, and then you'll wake up, and then you'll start walking, and you will look like a zombie when you start doing that. Sleep disordered breathing is a disorder characterized by abnormal breathing, also known as sleep apnea. Usually it's gone for kids when they turn into their teenage years, but in adults it can also occur again if there's a use of alcohol or any kind of prescribed medications that can also develop hallucinating, and you can also have medical conditions such as seizures that can cause it. Some of the symptoms that are caused by sleepwalking is when you sit up, and if a person is next to you, they will know that you are about to sleepwalk. When you wake up, when you are about to get up, they call it an episode, and the episode usually lasts for about 10 minutes to about 30 minutes, in which you can do a lot of different activities. According to Dr. John Mean, MD, a person can appear very clumsy or very dazed when they're walking, and they attempt to escape. If you see somebody walking, it is best told not to wake them up. But you can try talking to them, and you can ask them what they're doing, and they will respond in very slow talking. But they look awake because their eyes are awake, they're walking, they're talking, but they're dreaming. They're kind of like awake and asleep at the same time. And they have the eyes open. And usually when they go back to sleep and they wake up, they don't remember anything. So if you ask them questions like, did you know what you did last night? They will not know anything. Or if they're alone and they see a stack of furniture by their door, they don't know why it's there. They're very confused when they wake up. The third thing I'm going to talk about is the treatments. Like I said earlier, it will usually disappear. According to Dr. Michael Baton, Santa Fe sleep doctor, says it can occur when sleep is disturbed, known as sleep apnea. It can lead to frequent awakening and increase the risk of sleepwalking. Obstructive sleep apnea is a blockage of the airway when the soft tissue in your throat collapses. So you can see over here, normal airway is open and the air is moving through your body. But in obstructive sleep apnea, the airway is blocked and does not move. So you can see how the airway kind of just sits there and it's like not going through your whole body. The second one is central sleep apnea, which the brain fails to signal your muscles to breathe. So it's really hard. Dr. Marcus of Pacific University said 20% of glaucoma patients have sleep apnea, and it can cause sleepwalking even more. And usually when you go to a doctor and you tell them that you can't breathe, they will give you a mask such as this that will help you breathe, that will not risk the factors of sleepwalking, and you can breathe easier. So now I've described you three causes, symptoms, and treatments of sleepwalking. So I hope that you guys one day don't wake up and are all confused.